Hi, and welcome everyone. Thanks so much for joining us today. We have an exciting topic about the future of ophthalmology, especially regarding AI and automation and how it's going to change our practices. The future of ophthalmology services, especially with advances in artificial intelligence and automation, is rapidly evolving. And AI isn't just a theoretical add-on, it's already starting to reshape how eye care is delivered, from screening and diagnosis to surgery and chronic disease management. Today, we're going to take a structured look at where the field is heading, backed by current trends and emerging innovations. Artificial intelligence, or AI, is rapidly transforming ophthalmology because our specialty is uniquely data rich and image driven. From retinal photographs and OCT scans to visual fields and topography, ophthalmology generates highly structured data, which is ideal for machine learning and pattern recognition. AI in ophthalmology primarily uses machine learning and deep learning. These are algorithms to analyze imaging, identify patterns, and predict disease progression, and optimize workflow. Ophthalmology is ideal for AI for high volume imaging, standardized diagnostic criteria, digital data integration in most practices, quantifiable disease progression markers, and screening opportunities in primary care and telemedicine settings. Because many ophthalmic diagnoses are based on image interpretation, AI can augment, although not replace, physician decision-making. Major applications in ophthalmology include AI systems which can detect diabetic retinopathy from fundus photographs with high sensitivity and specificity. These systems enable point-of-care screening and primary care settings, reduce screening burden on retina specialists. These systems enable point-of-care screening and allow for reduced screening burden on the retina specialists, improving access to underserved areas, and provides rapid triage decisions. This is one of the most mature commercially implemented AI use cases in ophthalmology. AI can detect macular edema, identify age-related macular degeneration, quantify retinal layer thickness, predict disease progression, and assist in treatment interval planning. And this supports retina specialists by improving consistency and reducing interpretation time. AI tools analyze optic nerve head images, retinal nerve fiber layer thickness, visual field progression patterns, and AI can model what the risk is so that early detection and intervention can happen. Because glaucoma is often asymptomatic early, this can benefit significantly from predictive modeling. Automated AI image interpretation is one of the biggest near-term transformations in ophthalmology. Retinal disease screening is an example. Deep learning algorithms can detect diabetic retinopathy, age-related macular degeneration, and other retinal conditions from fundus photos and OCT scans with accuracy that's comparable to specialists. And this allows earlier detection and prioritizes patients who need urgent care. Predictive analysis is where AI can synthesize large patient data sets, including imaging, genetics, and clinical history to predict disease progression, for example, glaucoma progression or AMD risk, tailor treatment plans and follow-up schedules, and also suggest optimal intervention timing. So this shift moves ophthalmology from reactive to proactive care. Let's talk about AI screening and surgery. AI and robotics are beginning to assist in ophthalmic surgery. Some benefits include that the robotic precision improves stability and control for the delicate procedures like retinal membrane peeling or cataract surgery. Robot-assisted surgery allows for improved outcomes and higher success rates, and real-time AI guidance helps with intraoperative decision support. For example, identifying anatomy or optimizing incision placement. Recovery time is typically reduced, and the underserved communities can have wider access to surgeons via remote surgery. We've all heard AI-assisted cataract surgery. It's already been adopted via the femtosecond laser system. It provides greater accuracy and disrupts the ocular tissue less than other methods, and it provides greater accuracy and studies have shown that half of the U.S. cataract surgeons offered or plan to offer laser-assisted cataract surgery. However, AI accelerates clinical trial design and patient selection, biomarker discovery, and automated analysis of high-dimensional data. The share of total cataract surgeries done with femtosecond laser lags surgeon adoption and is lower at an 8 to 9% rate nationally. So although widespread adoption is early, these tools aim to enhance surgical accuracy and outcomes while reducing variability. AI is enabling mobile and cloud-based eye exams, including smartphone-based retinal imaging with AI interpretation, virtual ophthalmology platforms that are integrated with AI triage tools, and this extends the reach of specialty eye care out of the traditional clinic settings. Let's talk about research and drug development. AI can accelerate clinical trial design and patient selection, biomarker discovery, and automated analysis of high-dimensional data. And this can help bring new treatments to patients faster and more precisely. Let me pause for a moment, because in today's challenges and our practices, does this sound familiar? Does this picture look familiar? Well, most practices train technicians internally for 4 to 16 weeks or longer. On paper, that feels economical, but in reality, it's expensive. You're pulling senior technicians off production, slowing clinic flow, extending onboarding, and delaying revenue ramp up. And conservatively, that costs about 2.5 times more than structured fast track training. At iCheck Training, we are one-stop shopping for ophthalmic technician development, from brand new hires to advanced certifications and leadership development. And we offer something that no one else in the country is doing at this scale, and that is a structured, live, 5-day new hire training boot camp designed to get technicians clinic ready in 1 week, not 1 month, not 3 months, not 6 months. And this isn't just training, it's capacity protection. It protects revenue, it protects your senior staff, and it protects your growth. If technician turnover and slow onboarding or burnout are impacting your practice, this changes the equation. Fast track training isn't an expense, it's a strategic advantage. Fast track training protects the physician productivity, capacity, reduces onboard variability and clinical risk. It accelerates technician confidence and retention and standardizes documentation and testing protocols, and it enhances patient experience and throughput. Fast track technician training is not an expense, it's a capacity protection strategy. So if you're struggling with turnover, long onboarding cycles, or tech burnout, this changes the equation. Stop training the old way and start protecting capacity. If you take nothing else from today, remember this: technician training should increase capacity, not drain it. And that's exactly why we exist. If you would like to set up a free 15-minute strategy call, just contact me and I will be happy to meet with you. Back to our webinar. So let's talk about how AI will affect the business of ophthalmology. Well, we have to consider ethical, regulatory, and practical concerns. With rapid adoption comes very important questions such as AI tools must be rigorously tested across diverse populations to avoid bias. And agencies like the FDA are developing new frameworks for AI-based devices. Patient data must be protected as AI algorithms access such sensitive information. And clinicians need training and trust in AI systems for widespread use. Let's talk about the changing role of ophthalmic clinicians. AI is not going to replace eye care professionals. It will augment them, though. And this is where the real shift happens, not in replacing technicians, but in elevating them to a higher value clinical operator. Technicians may take on expanded roles with automated tools. Routine screenings could be delegated to AI-assisted programs. And this means a shift in training, workflows, and focus areas. AI algorithms are only as good as the image quality fed to them. So the technicians need to be able to attain quality images. They need to know how to deal with poor fixation, dry eyes, artifacts, lid interference, media opacity, and motion blur. All of these dramatically reduce AI accuracy. Let's talk about the technician workflow. So our current model is they capture the image, they send it to the doctor, and then they move the patient. However, with AI integrated models, they're going to be capturing the image, evaluating the image quality score, and then reacquire if it's below the threshold, recognize artifacts that can cause false positives, annotate clinical context such as high myope, post-op cataract, epiretinal membrane, etc. And they're going to need training in advanced fixation coaching, tear film optimization, such as applying artificial tears prior to imaging, how to adjust positioning to acquire a quality scan, and recognizing of segmentation errors in OCT. Practices that invest in imaging training will get more accurate AI outputs and fewer unnecessary doctor callbacks. AI won't eliminate tech tasks. It will automate repetitive cognitive work. For example, AI automated refractions, which the tech would verify reliability of. Also, the tech would interpret output trends and reconcile the refraction with the patient's symptoms. AI glaucoma progression analysis is another example. So the tech can flag suspicious changes, compare the AI report with prior trend data, and prepare a summary for the doctor. AI dry eye analysis can include grading the meibomian glands, assessing tear film metrics, and automated osmolarity integration. So these are all challenges and changes in technician roles. So technicians become clinical interpreters of the AI output, and this elevates them from data collectors to clinical extenders. Technicians may also be responsible for workflow oversight, ensuring AI reports attached to correct patient charts, monitoring system downtime, identifying discrepancies between AI and clinical findings, and even escalating false positives. Compliance oversight is another area of opportunity. By confirming physician review when required, understanding when AI is autonomous versus assistive, and maintaining documentation for audits. AI adds complexity to the workflow. Someone has to manage that layer. And in many smaller practices, that will not be the doctor, it will be the senior technician. Technicians will no longer just be, quote, rooming assistants. They will act as scribes and data managers. AI documentation tools are growing rapidly, and AI scribe models are getting better and better. Instead of manual typing, AI listens to the encounter, drafts notes, suggests coding, and auto-populates exam fields. Imagine that. The technician role will turn into real-time quality control by correcting inaccuracies, ensuring proper ophthalmic terminology, confirming laterally, validating exam elements for billing compliance, and then let's talk about data validation, making sure image metrics match documented exam, confirming visual acuity values, and reconciling refractive findings. Then we have to think about coding awareness. The technician would review suggested CPT codes, flag mismatches, and then avoid overcoding and undercoding. So this shifts the tech towards a clinical documentation specialist. As such, the technicians will need new skills. So the future tech skill set will include technical skills plus imaging optimization, OCT segmentation review, AI output interpretation, and EHR analytics familiarity. The cognitive skills will be pattern recognition, workflow troubleshooting, and critical thinking about AI limitations. Then we have communication skills, which includes explaining AI reports to patients and clarifying that AI does not replace physician review. It's a tool. They also will need to manage patient concerns about automation. Protecting patient information is essential in the digital age. Robust encryption and secure storage practices must be implemented to safeguard sensitive health data from unauthorized access and breaches. And also, AI can have an algorithmic bias, and ensuring fairness in AI is crucial to avoid biased outcomes. So continuous monitoring and diverse data sets are necessary to develop good algorithms that provide equitable treatment across all demographics. As AI becomes more embedded in ophthalmology, one thing is becoming really clear. Technology does not create excellence. Trained technicians do. Practices that intentionally develop high-level technicians see measurable impact through increased throughput because their rooms turn faster and data is captured correctly the first time. They also reduce physician burnout because doctors are working at the top of their license instead of correcting technician errors. They also improve diagnostic accuracy because high-quality inputs produce high-quality AI outputs. They capture more screening revenue because opportunities aren't missed, and they reduce documentation errors and increase coding accuracy. And this directly protects your reimbursements. But here's the other side. Practices that invest in AI without investing in training underutilize expensive systems. They experience workflow chaos, they create compliance risk, and ultimately, they can lose competitive advantage. AI amplifies the level of your team. If your technicians are strong, AI makes you exceptional. And if they're not, AI simply magnifies inconsistency. Remember, AI is not the differentiator. A highly trained technician workforce is. Let's talk about the timeline of AI. So by 2028, we should expect diagnostic tools will become better and faster in improving patient outcomes. By 2030, robots will be performing complex surgical procedures, which help reduce human error and improve outcomes. And by 2030, we will be tailoring treatments for each individual patient, which will revolutionize healthcare approaches. By 2035, projected market growth in ophthalmology is expected to be $10 billion. Ophthalmology is going to have astounding growth with the increase in demand for eye care solutions. Here's our contact information. I think I'm done with the webinar. And if you'd like to schedule a 15-minute strategy call, please contact me. Our information is here. And before you leave, thank you for joining us today. And I hope you found value in this webinar. Next month, we're going to focus on maximizing retention through competitive compensation and benefits packages. And that'll be on Thursday, April 24th. I hope to see you then. Thanks for joining us.